Imagine sitting down for dinner and finishing your meal, only to realize later that half the food on your plate is untouched. Or imagine standing in front of the mirror to apply makeup or to shave, and strangely enough, it took you only half the time. Not because you did it faster, but because you didn't work on half of the face. It sounds like a surreal dream, but people living with a condition called hemispatial neglect, this is daily life. Hemispatial neglect usually develops after a stroke, usually when the right hemisphere of the brain is damaged. A key area involved is the right parietal lobule, which integrates spatial information and orients us to the environment. When this region is impaired, the brain simply fails to attend to one side of the environment. Despite having perfectly normal vision, the brain simply does not attend to one side of the environment, usually the left side. The most fascinating part is that people living with this condition often do not realize that anything is missing. They feel that the world is complete, even though half of it is simply disappearing silently. In clinical tests, when asked to bisect a line, patients drew way too far on the right hand side. In cancellation tasks, all the targets on the left were completely ignored. And in the famous clock drawing test, patients squeezed all 12 numbers on one side of the clock. Beyond clinical settings, this condition invades daily life in unsettling ways. Food goes untouched on one side of the plate, and patients often insist that they've finished their meal. Clothes are often worn on only one side of the body, for example, wearing only one sock. Women often forget to apply lipstick or makeup on one side of the face, and men often forget to shave on one side of the face. Sentences are read only halfway through a page, and family and friends sitting on one side of the hall or area are often neglected and might lead to social interactions, difficulty, or strained relationships. Most dangerously, while crossing roads or seeing emergency signals on one side of the environment, might lead to hazardous incidents. The consequences of hemispatial neglect extend across physical, psychological, and social domains. Physically, patients are far more likely to fall or injure themselves, and studies have shown that 40% of the patients that have right hemisphere stroke develop neglect, and this sustains far more accidents in hospital settings. Psychologically, many are unaware of this deficit, a phenomenon called anosognosia, and they often think that they are dressed fully or they've eaten their food completely, whereas half of it is missing. Also, this contrast between the belief and the reality often frustrates them, leading to depression, anxiety, and helplessness. Socially, the relationships suffer. Sitting in a room full of people, even though they don't intend to ignore one side of the room, they might come across as rude or uncaring. And caregivers often need to constantly supervise them and adapt to communication styles, which kind of is a huge responsibility for the caregivers, and hence the patients with hemispatial neglect often feel that they are being too dependent or they are burden on others. Neglect is not just about seeing the present, but it also distorts imagination and memory. In a classic experiment, patients were asked to imagine standing in a familiar city square, and they described the right side of the buildings. When asked to imagine standing on the opposite side, they again described the opposite side of the buildings, ignoring the left side. This shows that neglect not only affects what the eyes see, but also what the mind recalls. So now the reason why left neglect is more common is it can be explained how hemispheres divide attention. So the left hemisphere usually focuses on the right side of the spaces, and the right hemisphere usually focuses on the left side of the spaces. So when the left side is damaged, it is less severe and can cover all the spaces. But when the right side is damaged, especially the parietal lobe, it is more severe and it completely abandons the left side. Neglect also links to alertness, and experiments show that neglect worsens when people are more fatigued or tired, and improves briefly when this alertness is boosted by cues. Now, interestingly, healthy individuals drifting into sleep also show a temporary form of neglect, and sounds and sights coming from the right side are completely ignored. This connection highlights that neglect not only is related to navigating spatial maps, but also about the body's arousal system. So for this treatment of hemispatial neglect, there is no single cure, but there are several therapies that have been proven to be effective. One of them is prism adaptation therapy, where patients wear glasses that shift the visual field by forcing the brain to adapt and correct its movement, and awareness of the neglected side improves. Now, experiments show that these benefits carry over daily activities like reaching for objects or navigating rooms. Another is visual scanning training, where patients are trained to deliberately move their eyes and head towards the neglected side. And reviews of rehabilitation trials confirm that this improves reading, navigating, and independence in daily life. So, other promising methods include non invasive brain stimulation, where it rebalances the hemispheric activity, limb activation therapy, which uses movement to re engage the neglected side, and virtual reality training, where immersive environments encourage exploration of both sides of the spaces. Since neglect often persists longer in a patient's life, long term strategies are crucial. Occupational therapy teaches compensatory habits such as beginning tasks on the left using reminders to scan spaces, and environmental modifications reduce risks like placing important items within the reach or marking obstacles with bright colors. Family education ensures relatives know how to communicate effectively, approach from the attended side, and gently encourage interaction with the neglected side. Community rehabilitation supports reintegration, offering opportunities for social, vocational, and recreational activities. The best outcomes usually come from interdisciplinary care, combining medical treatment, psychological support, and environment adjustments. In conclusion, hemispatial neglect is one of the most striking and disabling conditions in neuropsychology, and it's not blindness but a collapse of attention where half of space and sometimes half of memory simply vanishes. Its impact is felt in eating, dressing, reading, relationships, independence, and literally every form of the patient's daily life. Yet research shows that recovery is possible with PRISM adaptation, scanning training, and long-term rehabilitation. Patients can regain significant function and safety. More importantly, neglect challenges our understanding of perception. It reminds us that seeing the world is not enough. The brain must attend to it. And when the delicate mechanism failures are come into pictures, we realize just how much of our reality depends on the hidden work of attention. Thank you so much.